You know, healthcare in America is a lot like the weather has been here lately in Chicago. I think, 2-3 days ago it was 80 degrees and now it's 30 degrees. And unfortunately, healthcare has been about unpredictable as that. But Surescripts, as a mission-driven healthcare company, a health information network, is really concerned about some of those challenges we've seen in healthcare. And we've got an excellent panel today that's here that's going to talk a lot about that.
Coming off of COVID, this was a time where, as Frank mentioned, the authorities that allowed pharmacists to be able to practice were nothing like we've seen before. But we were able to step up to the challenge of that. So for 2.5, 3 years, we've had this steady drumbeat of, if you're not sure what you have, you can go to a pharmacy and get tested to take the next best health action.
When I say we're working to expand pharmacist scope, I don't want, like Anita said, I don't want to, give any impressions that we're trying to move in on anyone else's profession or territory. We are working at a state-by-state level, community-by-community, to expand scope, to provide services that are needed in those communities. So we have the convenience, we have the value, we have the ability, we have the evidence, and I'm hopeful that we can do a better job of recognizing the value of pharmacies in helping provide that care more efficiently.
Empowering providers to move forward in a value-based care model with gap closures, with data systems, and the very challenging move to include enough clinical data interoperably that we can share with larger care teams. That will be a key to make an equation of a healthcare system shine, is we need to be able to give meaningful data and receive it in a way that makes decision points at the moment of care facilitated.
We've got to create a system where you can first find out what is my status, and then the follow-up of what do I do next, how am I doing? And all of that needs to be shared across the care team. So when we think about data, there's two components of data that as we think about value-based care are super critical. Sharing of information, how quickly can you share it, and what do you have to share? It's not about all of the data that's out there, it's the key metrics, the key elements that you need in order to be able to care for a patient or to exchange information. The other is outcomes driven. How do we measure outcomes? What does good look like? And how do we really know the health of that individual patient?
Well, it comes down to the communication piece, and I think all of you have touched on a little bit. The need to have the right information at the right point, at the right time when you're faced with the patient. And that's where I think interoperability is making a huge change to us. The drive by Mickey and the folks at the ONC having really promoted interoperability. The first wave of it, pharmacy really got left behind. They weren't really included. The pharmacy operating systems weren't as integrated in that. And I think we're going to see, again, an important point will be that pharmacists do have that right information.
We need to have some ability to create some data pools that have meaningful access without hobbling restrictions. We need to have some ability to assure people of their privacy and their skepticism about profiteering and scraping their data and moving forward. So what would it look like? It would look like a data pool that we could all access and feed.
I think the piece here is, what are we talking about in terms of volume of data?
Yep.
For a pharmacist to be able to operate, it's really basic data and information on that individual patient. Again, we're not trying to do complex care services. We're trying to be a complement to primary care. So in that vein, we're talking about a smaller subset of data and information exchange. The most important thing is, can we make sure that that primary care provider, the next healthcare team member has the information they need to take their next actions. So communicating with the patient, there's a digital component there, interoperability component with other care providers, but we don't need all of that data. And so how do we set up a structure that allows for a quick, rapid information exchange based on the basics of that individual's health and movement of information to who needs it? So I think that's the other piece is, how complicated are we trying to make this? How simple can we make it? So that we're really thinking about what do you need in order to do your job.